Are you going to the bed?
Hello, and welcome to the Natural Pet Health segment of the Health and Wellness Show. Last week we talked a bit about what you could do for your pets if there was an emergency and you couldn't take them to the veterinarian as soon as possible. Hopefully this information was useful for you, especially since it's probable that not all of the mentioned substances can be found in North America or Europe, like potassium permanganate solution, or maybe they can be found under a different name or are used for a different purpose. As for techniques like treatment of burns that was mentioned in a previous show, or giving your dog a sweet tea, they may also sound strange to some people or even veterinarians. So just to reiterate that all the advice that was offered was for emergency cases plus inability to reach veterinarian quickly enough. You could say that all the advice is useful in case of the so-called field conditions. But if you have the ability to reach veterinarian, always better to do this first. Okay, so today we're going to finish talking about emergency cases, and I'm going to give you a list of necessary items you should have in your special My Pets emergency bag or box. You will notice that many of those items can be used on humans too, so there is a double good reasons to stock on those supplies, and they are usually not particularly expensive. And just for the sake of clarity, I made a research and looked for substances that are available both in North America and Europe. So here it goes. One first item that you should have in your first aid kit is a muzzle, or a collar, or a leash. It's important. I understand that maybe your pet may be stressed, maybe in bad condition, and he is already frightened. So basically, putting a muzzle may seem as something cruel, but you must understand that it's not only for their protection; it's also to protect the humans handling and caring for the animal. Animals are usually, some animals become aggressive when they're afraid and in pain, so you should keep that in mind. You should keep a pair of tweezers for splinter or tick removal, a nail trimmer or clipper, a pair of blunt tipped scissors to trim hair away from a wound, or to clip out foreign material caught in your pet's fur. In North America, or maybe in Europe, you can find, instead of iodine solution, maybe you can find pre-soaked pads to clean out cuts, wounds, or abrasions, and bottled water. The wound should be flushed with water after using pre-soaked pads. Instead of permanganate solution, you can find and use saline solution. Regular human contact lenses, saline drops can be used to flush out dirt, sand, or other irritants from your pet's eye. It can also be used to flush away debris from a cut or scrape. Antibiotic ointment to apply to a wound after it has been cleaned with iodine solution and flushed with water to prevent accumulation of all kinds of potentially harmful microorganisms. There are all kinds of gel, lubricating gel, for example, around your pet's eye. If you need to use soap or iodine solution to clean a wound close to the eyes. You can keep in the emergency box, sterile non-stick pads to cover a wound before bandaging. Other bandage material, either elastic bandages or gauze, to hold the non-stick pad in place over a wound. And you can keep hydrogen peroxide. It's a 3% solution. Now, there is a controversy regarding hydrogen peroxide and using it to clean a wound. Some veterinarians say that it actually slows the healing process. I made my research and still it's not... basically, I can tell you for sure 100% who is correct here. Because some sources say that it doesn't affect healing process in any way, but some, like Karen like Dr. Karen Becker says, that it does slow the healing process. So maybe it does, but it is useful to, for example, remove blood or all kinds of clotted and dirty and dry sticky stuff on the wound. So you can use that to basically to make it a bit moistish. And also hydrogen peroxide can induce vomiting, but use it only after you talk to your veterinarian, and he said that it's okay to do it because each case is specific. So you always need to check this beforehand. Another item is a clean cotton towel that can serve multiple purposes, from a pressure bandage to a blanket, to a sling to lift a larger pet that isn't able to walk. And you can also have flashlight. Sometimes a bright light source can help you more readily identify the thorn in your pet's paw or the tiny tick in between her toes. And also you can use it maybe to check the eye, the ears. So basically it's a useful item also for humans to have it in emergency kit. Other items you may include cotton balls and swats, and also Benadryl for allergic reactions, a Bach rescue remedy for stress, homeopathic aconitum for shock, and you can also use a thermometer. For example, if you can't reach the veterinarian but you can talk to him or her over the phone, so you can basically take a temperature by yourself. It's using a rectal check of the temperature, body temperature, and then tell them over the phone the results. Now make sure to keep your kit in an easily accessible location and let everyone in the family know where it is. If you're traveling with your pet, it's a good idea to either bring the kit along or prepare a second kit for the car. And remember that administering first aid to a sick or injured pet is just the first step, and you still need to get to the veterinarian as soon as possible. Now, this is it for this part, and this is it about the emergencies. But now let's talk about a different but no less important topic, which is also related to the general topic of today's show. A week ago, I received a question from the listener. The question was about an obese 12-year-old little dog which was just diagnosed with Cushing disease and prescribed 2 specific drugs that are very expensive. The cost is $200 a month for the rest of dog's life. And the listener wanted to know if she should do the treatment, especially since the vet also told her that she should choose not to do the treatment. She could choose not to do the treatment and just let things progress as they are. Well, since I'm not a doctor yet, I can't really give a definite answer. But what I know about drugs that are prescribed in case of Cushing disease, which is a condition that has several reasons and is characterized by an excess of the steroid hormone cortisol in the blood, that most of them have serious side effects. In fact, these drugs are not for treating the disease but for maintenance only. It helps to control the symptoms. That's why they should be taken for the rest of dog's life. It's exactly like chemotherapy for life. It's true that newer drugs are better when it comes to side effects, but they are also more expensive. So in the end, it doesn't matter how you look at it. There is loss or suffering in any of these cases. And that's what I wanted to talk about the grip Big Pharma has on veterinary science and how often veterinary students are being taught not to think, but instead are asked to memorize all the necessary treatment protocols and their dosage. Let's take this poor little obese dog with Cushing as an example to demonstrate the point. In most affected dogs with Cushing, the cause is a small benign pituitary tumor. It happens mostly with middle-aged or older dogs, and there are several breeds that have a predisposition to the development of this kind of tumor. Okay, so if it's a tumor, then what? It's like the universe's Russian roulette? Some dogs lose or some dogs win? Wrong. Predisposition to any disease, including development of cancer, means just that, a possibility, meaning that if there won't be any contributing factors, your dogs can live happily all their lives without developing anything of this kind. And contributing factors can be starting from stress, bad diet, like feeding your dog dry food and giving him all kinds of medications, especially steroids. And here we come to the biggest conundrum, both of veterinary medicine and human one. You see, despite me studying in a low-budget university and not having access to super advanced and cool veterinary equipment, they were able to give a couple of the most important principles of being a veterinarian. Beside the principle of doing no harm, they also told us that a good veterinarian is a veterinarian with nothing to do, meaning the disease prevention is much more important than treating the disease. And if this is being kept in mind, then it's easy to see why proper upkeep or proper living conditions and species-appropriate diet are all the animal needs to have a good and long life. And what is left are emergency situations, including emergency surgery in case of accidents. So both in human medicine and in veterinary one, there is this absurd situation where more and more fancy and advanced techniques and drugs are being developed, new treatment protocols, etc. Better diagnosis techniques, better everything. Right now in US and Europe, there are all kinds of veterinary clinics that can give your pet the best diagnosis and treatment in the world. Veterinarians are very proud of their profession, and rightly so. But then, in many cases, they are being misguided or taught to believe and accept things that are very wrong, just like in human medicine. Okay, so this little obese dog's owner still has to decide if she is willing to pay $200 a month. This may ease not only her dog's symptoms but also her conscience that she did something for her little baby. But then, who knows if she would fed her dog with species-appropriate diet since childhood, if she was told by her veterinarian years ago that diet and stress have major effect on the hormonal system, maybe she would make sure to feed her dog properly and give him stress-free environment as much as possible. But then, what interest Big Pharma and other similar greed monkeys have in educating the public? No interest at all. And that's why both medical and veterinary fields are in constant state of a so-called advancement, while it is really an illusion and we are just getting further and further away from what is real and natural. I think that's enough for today, and thank you for listening and have a great day. And goodbye.